powerful documentary, touching on so many issues concerning COVID-19 in Papua New Guinea. Well, since that documentary film was made, the situation in our country has become worse. There is so much confusion out there with false information, lack of awareness, and COVID cases and COVID deaths are rising in Papua New Guinea. Joining us now is Dr. Glenn Moller, who is a household name in PNG and has been practicing medicine in our country since 1970. We have filmmaker Marco Venditti, who wrote and directed the documentary we've just seen, and businesswoman and owner of Paradise Private Hospital, Ms. Janet Sios. Welcome to the three of you.
Thank you.
Thank you.
Well, Marco, first of all, I might ask you, we have got a lot to talk about in this very short time, but I just want to ask you about that documentary.
Right.
And what was the most confronting thing to you about going through the process of capturing those stories and capturing the real picture of what it's like here in the country?
Right. Well, look, the moment we started making this documentary, we knew that we couldn't say everything. There is absolutely no way that we can say everything in 40 minutes. But we knew that we wanted to capture some of the most important aspect of this pandemic that has been, essentially affecting our life for the past 2 years. So we decided there are certain elements that needed to be as part of the documentary. And one was certainly wanting to understand what is happening at grassroots level in PNG, because I think this pandemic has been a little bit too intellectualized sometimes. We always, having the discussion a little bit high up about what is happening to the men on the street, how they understand it, and what they are willing to do about it was certainly something that we wanted to put as part of the documentary. And the other aspect, which was a little bit sensitive, was the religious aspect. How do people respond to the pandemic and what kind of association they give it with some of the religious explanations. As I said at the beginning, there is no way that you can be exhaustive in 40 minutes. And there is a lot of other stuff that we left out of this documentary, which I hope we're going to explore today in this conversation. It should be the nature of the discussion today, I think.
And Dr. Moller, I could feel your frustration and despair coming through in that documentary. Thank you so much for being tireless for our people, your people. Tell us about maybe what is your greatest frustration as we sit here now?
I think my greatest frustration is health workers who are working against us, health workers who in fact are sabotaging our best efforts to get out of this epidemic situation by being unscientific, illogical, and recalcitrant about being health workers, for heaven's sake. Anti-health, I'd have to say, particularly our nurses. Most doctors are vaccinated because most doctors understand the scientific basis of how vaccines work, how vaccines protect us, how vaccines have no association with electromagnetism or religious entry of the devil into our bodies or anything of that nature, which is what some of these street preachers and other influencers in our society, a couple of doctors, and I don't even hesitate not to mention Dr. John Tonner and Dr. Sam Mima, who were my students, and I'm so disappointed. They didn't seem to understand the education that we provided for them several years ago.
So you went into the coalface, you went into where most of Papua New Guineans live, which is in settlements and villages. What did you find were the main issues preventing them from knowing the right thing to do?
Well, first of all, it was fascinating in the sense that the moment that you enter into a settlement, like there are so many settlements in Port Moresby, I think that's just one that we visit. I think I heard there are about 13 or 14 settlements in Port Moresby alone. And it's fascinating to see the dislocation, the distance, of the knowledge and the understanding on the issues from mass communication on you need to do this, wash your hands, wear the mask, social distance, all of that stuff doesn't apply at all to these people. First of all, there is no social distance, as we've seen in the documentary. In most of these settlements, families live, in one single house. Maybe you'll have 10, 15 people living. What kind of social distance can you apply in a situation like that? Washing your hands, they have one point of water, maybe for 20 families. Mask, I haven't seen a single person wearing masks. So all that stuff in a way that has been borrowed by the international sort of standard how to go about the pandemic doesn't apply at all at that level of society, at least in Port Moresby, but I think Lae is the same in many other urban centers. So it was fascinating to see how much distance there is and how much there is to be done exactly there. So for me, that was quite shocking to see at the same time.
I feel like that's a similar case for our remote areas probably haven't. I mean, if they can't even reach people in Port Moresby, then how do we know if that message is getting through? Have you spent much time outside of Port Moresby during this, or, I mean, I'm sure you're in communication.
Communication. I went to Goroka
Yes.
last month. Interestingly, these nurses, there were 3 of them who were vaccinated out of the
Okay.
12 when I arrived. And when I left 5 days later, all except 1 were vaccinated.
Well, that's something.
Well, I should say it had the first shot
Okay.
on the way.
You mentioned the first shot. I want to talk about that, the notion that if you've had 1 shot, you're vaccinated.
Yeah, so the first shot, as I've already mentioned, educates your immune cells how to do it.
Yeah.
But they don't do it yet. It's like you've got the pilot's license, but you haven't flown the plane yet. So getting the experience now on how to actually make the neutralizing antibodies requires that second shot to set off that process. Number 2 shoot, plus also not 2 weeks long, only making all its antibodies now, you can talk, say, me vaccinated, me protected for this.
Yeah. There is endless supply of misinformation going around. I wanted to have a look at these questions that have been sent in with general questions about the vaccine. I mean, we've heard that we're guinea pigs. We heard that debunked in the documentary. We are the last people to getting this vaccine currently. I don't know what the global stats are.
3 billion now?
3 billion.
3 billion.
So we have 3 billion guinea pigs already, proving that 3 billion people are not dying from the vaccine. Yeah. The one that is quite common is people asking about pregnancy. Is the vaccine going to stop women from being able to have babies? If you're pregnant, you can't have it. Those kind of things.
When new vaccines are introduced, we don't give them to very small children or babies or pregnant people to begin with until we find out whether it's safe and effective. Because pregnant people, women and little babies and small children are different organisms. So we have to do separate research. Once we've proved that vaccines are safe and effective for older children and adults, there's still the further step to go to prove that they're safe and effective for babies and pregnant women. So that research was completed about 3 months ago, and all the international specialist agencies throughout the world have now reached consensus, reviewing all this research, to declare that the vaccine is not only safe and effective, but recommended. Recommended for women who are either planning a pregnancy or already pregnant. So these vaccines are safe and effective. Lo Start, la UK, Royal College of Obstetricians and Gynecologists, lo Australia, the American College too, all got lead agencies, long Save, long Wanem kind good something, long Mama got Bell. Orgata 1 bell staret, long all pregnant mama, only mask is in vaccine.
We have 3 different kinds of vaccines available in PNG now, right? The AstraZeneca,
Yeah.
the Johnson & Johnson and the Sinopharm. Can you just clarify what the differences between these 3 vaccines are? If getting the 2 doses is better than the 1 dose? Can you just clarify?
Okay, so a Sinopharm vaccine is actually run out.
Okay.
So we'll leave that one aside.
Yes.
It's a good vaccine. The Chinese brought a limited supply, and it's been used, specifically brought for all the Chinese and Asian people in PNG, but also it was made available to Papua New Guineans, and it's now finished. Then we've had the AstraZeneca vaccine from the very beginning, and it's probably the best all-purpose vaccine in the world because it's easy to store. And you have to have something that works, right? You can't have a theoretically slightly better something like the Maseratis, right? Because we can't service them, we haven't got the fuel for them, etc. So
Yes.
bad luck, best car.
Yeah.
We'll have to make do with Mercedes-Benz.
Yes.
Perhaps a Toyota would be
Maybe
okay.
a Cruiser,
Yeah, okay.
yes.
Yes. And the AstraZeneca is like your Land Cruiser.
Yes.
It's the best all-purpose vaccine for our purposes in PNG because it's very effective, it's very safe, and we can store it easily
That's
and
right.
distribute it easily. So that's the best thing about now. The Johnson vaccine is a similar vaccine and produces both the education and then the stimulus. So the Johnson one stays there for a couple of months, so it produces both to begin with the education of your immune cells and the prompting of the immune cells 2 months later to produce the neutralizing antibodies. So from a logistic point of view, hard work will give him shoot, yeah? Nice, yeah, give him one plus shoot. Because you go give him shoot long border below Western Province, na area, and West Papua or something, hard will go back here.
Go back in,
Hard will
yes.
go back.
Yeah. Sorry, Dr. Moller, we're overloading you a little bit with questions because most of these questions
Technical.
have come, they're from a medical perspective. One thing that has been a little bit disturbing coming out is that all the discussion around the COVID vaccine is also having an impact on all the other vaccinations. Janet, have you noticed this at your hospital, whether people are starting to feel frightened about just getting the normal infant and child immunisation shots?
Mothers are still allowing their babies to be vaccinated.
Great.
So I don't understand why people cannot take it that it's the same sort of protection you need to get, when you're a baby.
Yeah.
So we should get this vaccination to protect us.
Yeah.
It's just happening to us as adults.
Yeah.
So this is the misinformation, mistrust
Yeah.
for such a...
Yeah. Is that true, Dr. Moller? Getting the COVID vaccine and the way this vaccine works is no different to the way immunisations we've been all having.
Well, there are different kinds of vaccine, and people have never queried this before. I mean, it's astounding to me about why people want to know. I mean, when you take your baby to the baby clinic, you don't ask the nurse now, is this an attenuated virus vaccine, or is this a killed vaccine, or is it a toxoid vaccine? Or...
I was 3 years old, I asked all those questions. I was very demanding.
Yeah, and it's extraordinary. But all of a sudden, people are fascinated by vaccines. Well, it's good, nice to be fascinated by vaccines, but it's the way the discussions are going are not useful.
Yeah.
I think after 2 years, we really should consider and thinking, what are we going to do in each society, to convince these people that don't want to be convinced? Because I think after 2 years, honestly, a lot of people have the right information by now if they wanted to. So, and I think we're seeing different parts of the world adopting different strategies. There was a moment where they were trying to give incentives to people, but I think that kind of stopped. And now we're going more into restrictions. In parts of Europe now we have green passes, meaning you just can't go anywhere if you don't show that you've been vaccinated. You can't go to restaurants, you can't go to cinemas, because they're just saying enough with this discussion, because by now we have all the information. You just don't want to hear it. And we can't risk our whole society to go again in lockdowns, millions of people having lost their incomes, families being torn apart. I mean, what else do we need to do something, really, honestly? I mean, what else does it have to happen in our lives to take this seriously? And I think this discussion is actually taking place in PNG as well. It's like, what are we going to do? It happens that we all live here, we all in Papua New Guinea at the moment, and this country, the numbers are, let's face it, really, really bad. I mean, we're talking about 200,000 vaccine, if I'm not wrong. Dr. Moll, I think at the moment is around
just over 200,000 now, yeah.
So that places PNG probably at the bottom internationally, I would say.
What percentage would that be?
About 3 to 4.
3 to 4.
Yeah, we've gone up from 2 to somewhere between 3.5 to 4 now.
At this pace, I don't know if we do the math, how long will it take to reach that 70-80% that we have already reached in Europe?
How about 100 years?
Yeah.
I mean, we need to speed up, I'm sorry.
Yeah. I mean, if Papua New Guineans just need to look at how other countries are now seeing the light at the end of the tunnel. Things are going back to normal. I have my grade 12 high school reunion in Brisbane right now this weekend happening, and it's just back to normal. Whereas we here are going to be quite a while. You can just look at our neighbour Fiji and how they are close to 80% first shot. In a couple of months
they will be getting the second shot, and
shot.
They will be vaccinated.
And then they'll be fully vaccinated. They can open their country up without...
The tourists again.
Yeah.
So if this approach hasn't worked so far, I'm not sure it will work in the near future, will it? I mean, how many Dr. Mollas we can have in the street going around preaching about vaccination if people just don't want to listen to it? So for me, that is really the question. You know,
Yeah.
what's going to happen? What needs to be done?
More deaths will occur, Mark. I'm sorry. More deaths will occur. And as deaths occur, people will change their minds. And it's very sad that has to happen. I mean, I've fought for sense for the last 12 months so that didn't need to happen. But I can see that possibly that's what it's going to take. And it's very sad.
Sadly, I think you're right. People I've noticed been complaining about is why are the hospitals reducing services instead of, you know, opening them? Janet, you would have been experiencing this at your hospital, the extra pressure. Can you just reiterate for us and describe the impact on the services that you need to provide when there's a high number of COVID patients coming in?
It's really terrible. I mean, main hospital is closing up, so private has to take in those extra burden from the public health, and it's really putting a strain on the staff as well. So I have to look for extra staff, you know, to cater for such an influx. So it is difficult all around.
And we saw that in the documentary. There's 400 doctors and 3,000 nurses. Now, this is not enough at the best of times. And it frightens me that so many of them are not vaccinated. Every single nurse and doctor is precious to us.
We've already had 2 specialist doctors die, both pediatricians, who would not get vaccinated. I mean, every doctor should think about that. I won't mention the name, one man and one woman, and both of them dear friends and colleagues. And it's just so sad that this could happen.
Yeah.
These are people who are meant to understand the science of it
Yeah.
all, but they chose not to get vaccinated, and now they're dead.
Yeah. It's probably a question for a psychologist or something, but I wonder what it is. Like, Marco, you mentioned how people, all the information is out there now. What is it about people that they come to an initial position about something, and even though all the facts start coming forward, they refuse to shift from that original position?
Well, I think Dr. Molla said it all. It's like there's nothing like a death in your family. I'm from Italy, and,
Yes.
and at the beginning of the pandemic, in March 2020, I was in the living room of my house with my hands, you know, my face, looking at the streets of Rome completely empty. My family in a total panic. My mother, 80 plus years old, isolated in the house. So. And then, you know, we all know now in Italy somebody either in our family died, a friend died, and all that. So the question is why PNG has not experienced as many deaths, and this is obviously a question that Dr. Molla can answer, because people here, they're being very, very simplistic in it. I don't see anybody dying. Why the hell should I do something about it when I can see people dying from malaria, I can see people dying from TB? Maybe this is something that really doesn't affect Papua New Guineans.
PNG has a young population. 75% of Papua New Guineans are under the age of 30. Serious illness and death is very rare for under 30s for these original versions of the COVID virus. Very rare indeed. So we didn't see much illness, we didn't see much death, and we became complacent. And then this Delta variant, which is the latest one, and we're going to get more variants, I tell you, whether they're going to be more successful or less successful, but evolution is that the more successful ones, they take over.
Yes.
Yeah, and that's what the Delta has done.
Yes.
There might be one that's on the way that's more successful from the virus point of view.
Yes, more
And
deadly for people.
People, yes, more infectious, more able to jump onto another person and get inside them, and more able to cause more multiplication within the person to cause disease.
So is there an age restriction or age limits around who can receive the vaccine?
Yeah, so our government has decided that anyone who's over the age of 18, or who's 18 and over, can walk into a vaccination centre and get the vaccine because they're classified as an adult person and they can make the decision for themselves. When you're under the age of 18, then there's legal issues about consent. And also the vaccine is less necessary for very young people because younger people, even with the Delta variant, are less likely to get very sick and die, although some can. Even some babies have died from the Delta variant.
The no jab, no job policy, we're now seeing a lot of people. Is that something that you're going to consider for your businesses?
The employers have to protect all of the other employees that are in the workplace, so they are making their own decisions. The people are marching against it, but hopefully common sense prevails, and people start to realize that if they don't have that in vaccination, they won't have a job, because a lot of the employers now are making it compulsory or important for them to have it.
Yeah. Just in general, before we have to wrap this conversation up, the idea of rights, people are saying it is my right to not get a vaccine, and it's a basic human right, and it's illegal and to force us, etc. What do you have to say? I'll start with you, Marco, and then I'll come to you, Doctor.
Well, I'm becoming an old man, and as far as I remember, I haven't seen the whole globe, the whole planet fighting against a pandemic. Other pandemics have happened in the past, and actually pandemics have killed even more people, but they were really confined to one nation or one region of the world. This is the first time really that the whole planet is trying to fight something that has disrupted our existence for the last 2 years. This is a time to work together as a global community. And we keep on hearing this word, global community, but it seems to be just a label. This is a time really to actually roll up our sleeves and really act as a grown-up citizens of this world. So yes, it is your right, I agree with you, but it's the right also for the people not to get infected. So we should be not so selfish for once. And so this is time to do it.
Yes, so is it a person's right not to get a vaccine, and is that person's right more important than my right not to get harmed by their actions?
So that is a community decision. I mean, people have the right to do stuff and not to do stuff. You can't drive your car at night with your lights off. You're a danger to other people. It's your right not to put the lights on, but it's against the law. I'm sorry.
Yes, that's right.
And you might suffer the consequences if you drive around the city without your car lights on. And the same thing I'd say for the vaccine. That's where we're getting to, because they're more likely to get the virus, they're more likely to have heavy viral infections which are more transmissible to others. So you don't have a right, I'm afraid, to endanger other people.
Well, time is against us and we have to end our conversation here. Thank you once again, Dr. Glenn Moller, Janet Sios and Marco Venditti.
Thank you.
And that ends our Life in the Ward Q&A special. But this is not the end of the conversation though. In the coming weeks and months, BLIT, the Digicel Foundation and TV1 will be bringing you more important discussions concerning this critical health issue and more. Stay tuned because our health, our lives and our future depend on being properly informed. I'm Tanya Bale. See you next time.